Hi everyone, and welcome to No Pants Academy. I'm Kathleen, and today we are talking about everything American freelancers need to know about health insurance. And with us today is Jeff Smedsrud. Jeff is the co-founder of healthcare.com. Hi Jeff, thanks for joining us.
Thank you. Appreciate the opportunity.
Thanks. So Jeff, could you start maybe telling us a little bit about healthcare.com and what motivated you to start it?
Well, our goal, I'm one of the co-founders of healthcare.com and had been in the health insurance business for many, many years, and also as a consumer advocate and somewhat of a serial entrepreneur, started a number of companies. But our goal at healthcare.com was to use technology to give consumers more option, information, knowledge about how to shop for health insurance. One size doesn't fit all. Each person circumstances are unique and different. And we thought with the technology that was available, we could create a kayak, if you're familiar with the kayak travel site, a kayak-like marketplace for health insurance that empowers consumers.
That's great. And it's all free, right?
Yeah, healthcare.com is free to the consumers. There's no charge of any kind to consumers for using our services.
Awesome. So say I'm a freelancer and I don't have health insurance and I don't know anything about it. What would you recommend that I do to get started? What are some key things I should know about?
Well, I mean, you could go to healthcare.com and get started, but some of the key things to know, insurance costs depend on your age, your zip code, the number of people to be covered, and very importantly in the individual market, depends on your taxable income. If your taxable income is below 400% of the federal poverty level, which really is about $50,000 a year for an individual, or $80,000 for a couple, a little bit higher for a family, then you're eligible for premium tax credits, which is the official term for health insurance subsidies. So you need to think about all those things: age, where you live, number of people to be insured, and what your income is. If you are eligible for subsidies, ultimately you'll need to buy a plan through healthcare.gov or through your state marketplace, but you can be connected to those plans in all kinds of ways, through sites like eHealth, through navigators, through folks like us, through independent agents. There's lots of ways to access that coverage, but income is very important.
Got it. So is there an alternative to getting insurance through the marketplace?
Well, if you're not eligible for a subsidy, you may want to look at what are called off-exchange plans, which are basically the same types of insurance plans that are available at healthcare.gov. They meet all the essential benefits, but they are purchased directly from an insurance company or from an agent or through web-based brokers. Those are, some of the better alternatives depending on your income. You could also look at short-term medical for a fixed amount of time. There are other, more niche opportunities such as faith-based plans and other things. But, by and large, if you're eligible for a subsidy based on your taxable income, the plans on exchanges make a lot of sense. If you are going to be using healthcare, I encourage you to make sure that you have a plan that pays for the basics.
Okay, so we've talked a lot about income. That's a real important part. When you go through the marketplace, you have to enter in your expected income for the following year. As a freelancer, sometimes it's hard to know what your income is going to be, especially if you're getting started. Is it better to overestimate, underestimate? What advice would you give to people?
It's a little bit like playing blackjack or something. Everybody has a slightly different opinion. I think it's better to overestimate your income a little bit. I like to be on that side than underestimating. If you underestimate, eventually you're going to be required to pay that amount. And you could possibly get yourself in some trouble for purposefully underestimating your income. So I weigh on the side of overestimating a little bit. but understand what the rules are about how to calculate taxable income. There's some quirky little rules in there that can be generally favorable to self-employed people in determining what that income is.
Okay. Can you give us a few of those?
Well, you need to think about taking advantages of all of your deductions as a freelancer. Remember that certain expenses, medical expenses above a certain amount of your taxable income can also be deducted. Think about establishing a health savings account and funding that. That also helps reduce your taxable income and is kind of a double preferred retirement and savings vehicle. So there's a number of things like that. But I think it's really important as a freelancer to understand everything that you legitimately can use to lower your income, because it helps you bring down your cost of insurance.
I'm sorry, can you repeat that? I think you said
if you think your taxable income is $50,000, but keep good track of your miles, you make a mileage, you keep track of your deductions, you contribute money to a health savings account, it could be that your taxable income is instead $40,000. And as a result of that, instead of paying $200 a month for a health insurance plan, or $300 or $400 a month, you may only be paying $100 a month. So it really has a very profound effect in making sure that your taxable income is truthful, but as low as it can possibly be.
Got it. Okay, great. That's awesome advice. Thank you. I don't know if you can really answer this, but what are the best plans or products for freelancers?
I think freelancers, like anybody who pays for their own health insurance, needs to think about 3 or 4 things. What is the cost of the plan? What is the out-of-pocket expenses that they might have to pay before the insurance kicks in? How much kind of everyday savings that person has in case something goes wrong, like unexpected medical expenses, what their income is. And it's not always the cheapest plan that's the best plan. If you regularly use certain medications and they cost a couple $1,000s a year, you might opt for a plan that's more expensive and has a lower deductible. If you're wonderfully healthy and are young and don't expect any medical expenses and don't have a family and kids, you might opt for a plan that has the highest possible deductible. I would encourage people that, excuse me, have young children, though, to think about a plan that has a reasonably low deductible, because you never want to put your family at risk. Sorry, I'm fighting off a little bit of a cold.
Oh, sorry. Oh, do you need some water or?
Oh, I'll be okay.
Okay. Great. So, so you mentioned families maybe want to go with the lowest possible deductible?
Well, not the lowest possible, but more of a moderate deductible.
What would that look like? So
I think that's in this day and age, that's a $2,500 to $5,000 deductible.
Okay. Okay. And what do you think for like a family of 4 with that kind of deductible? What would the premium be?
Well, it's going to vary depending on your location. It's also going to vary depending on your insurance company, which may vary depending on who's included in their network of physicians. Mm-hmm. But I marketplace plans right now, probably $700 a month for a family of 4, maybe more depending on your age, depending on the number of children. It's expensive.
And for a single freelancer who maybe doesn't have a lot of medications or health problems?
I think it could be $200 to $300 a month. But again, that's where the subsidy really comes into play. And understand those those types of considerations, because if you're eligible for a subsidy and you can bring your insurance premium down to $75 or $100, that's very important. The average premium paid net for somebody through healthcare.gov is $85 a month. Now, the average premium paid gross for somebody not eligible for health insurance or for subsidies is about $500 a month. You know, averages tend to distort things, but see the big range of difference in the importance of income.
Got it. So with all of what we've talked about so far, is that just medical? Is dental and vision like a whole separate thing?
Generally dental and vision is a separate item. There's sometimes plans called gap plans that sometimes make sense. If you have a higher deductible, you can buy plans that cover costs for unexpected accidents or a critical illness that gives you a little better cash flow and things like that. So, but dental and vision generally are outside of health insurance plans.
Okay, and they're usually not very expensive, right?
They're really not. But you know, if you're buying an individual dental plan, expect there to be certain limitations on when the coverage takes effect or how much it actually is going to cover, or else, you know, we'd all be buying dental insurance the day we get a cavity and dropping it the day after we see a dentist.
Yeah. Okay. Would you recommend short-term insurance for maybe people who are just making the transition from full-time work to freelancing?
Yeah, I think there's niches for short-term medical insurance. But one of the things to remember is that two things to remember. One, it really should be for a short term. It's not meant to be long-term in nature. And secondly, there are some limitations for those that have pre-existing conditions and they may not be covered. So short-term is a good fix for people between jobs, people moving at the end of the year that don't want to buy a plan with a high deductible, people in the gig economy that jump around a lot. Those types of niches, early retirees who are freelancing for the last 6 months before they go on Medicare. There's a lot of spot markets for short-term medical, but it's not a permanent solution and shouldn't be thought of that way.
Is it typically more expensive?
Short-term medical is usually about roughly half the cost.
Oh, okay.
Marketplace plans. Yeah, it's quite affordable.
What would be the drawback then?
If you have a short-term medical plan, it doesn't cover all of the benefits that a ACA or an Obamacare plan would. So the benefits aren't as good. At the end of the short period of time, if you apply for new coverage and your medical conditions have changed, you may not be eligible. And short-term medical still would require you to pay the mandate or tax penalty for not having a qualified insurance plan.
Oh, okay. All right. So we do have some questions from our community. The first question is, what should freelancers do when they travel from country to country as they work?
Well, that's a great question. There's a number of very high quality travel accident insurance plans out there. I'd encourage you to make sure that any coverage you buy includes some transportation related coverage to help you get out of what country you're in at the time if you want to go somewhere else for treatment. That's an important consideration. Understand that your individual health insurance may not cover you in most overseas markets. So you may need to buy a specific policy.
Okay.
Sorry.
That's all right. You talked a little bit about the tax credits. Could you maybe explain a little bit more how they work? And this person wanted to know what the income limits were for families of 3.
It's up to 400% of the federal poverty level. I don't have that in front of me, but I think it's right around $80,000 to $90,000. Anything below that would allow you to get some premium tax credits. They're called refundable premium tax credits. So you calculate what your taxable income is, and if your insurance plan was $500 and you're getting a $200 subsidy, you basically end up paying your insurance company $300. So you don't pay the full $500 and get the money back later from the government. You pay the net amount. One other thing that gets a little tricky, if your income is below 250% of the federal poverty level, and again, it gets to be relatively low income, then you're eligible for what's called cost sharing reductions, which help bring your deductibles and your co-pays down even further. So it's something. If your income is in that range, go to healthcare.gov or your state exchange or work with an agent and get the best advice as to whether or not it's better to have a plan that costs slightly more and gives you a lower deductible, or one that costs very little but has a slightly higher deductible.
Okay. What health insurance costs are deductible for self-employed business owners?
I'm sorry?
What health insurance costs are deductible?
Well, your cost of your insurance premiums are deductible from your taxes. Medical expenses above, I think might be close to 10% of your taxable income out of pocket are deductible. Any contributions you make to a health savings account are deductible as well.
Okay. Can you do a health savings account with a parent and a child, just two people,
Yes.
and write the contribution as a business expense?
Yes, you can. And anybody can contribute to your health savings account. Only you can take a deduction for it. But if your parents or a contractor that you're doing a gig with, talk to them to see if you can get them to make a $1,000 contribution to your health savings account. That it's not taxable to you. Anybody who contributes money, if you receive money from somebody for your health savings account, it's not taxable income. So.
This person says, I currently do not have insurance. What if I sign up and I've already had previous medical expenses out of pocket in the last 3 months? Can I retroactivate the insurance so it covers that?
The short answer is no. You can apply for coverage and not pay right away. And if you decide later to drop your coverage, you can do that. But if you incurred medical expenses at a time when you were uninsured and had more than a 60-day break in coverage, you probably cannot get coverage for that. It's one of those very nuanced things where if your coverage ends and you have a period of time to apply, there might be instances when you would have coverage, but nobody should count on trying to retroactively get coverage for prior illnesses or accidents.
Okay. So on healthcare.com, you offer a lot of different options, right? You can go through the marketplace or work with an agent.
We give consumers lots of choices, and I think that's the most important thing is to make sure that people can compare on exchange, off exchange, short-term medical plans, other types of plans. They can use our tools to determine what might be best for them. They can read stories and blogs and see what the experts say about what some of the better choices are. So we're trying to just empower consumers, give them as much information as possible, and allow them to make the best choice for them and their needs.
It seems like healthcare, it seems like it's always changing. Where do you see it going from here? Like it feels a little overwhelming to keep up with it. Is that something that you guys run into running your site?
Well, I think over time, it may take a few years. I think health insurance becomes more of a commodity that's easier to evaluate and easier to buy online. I think there's also going to be an evolution of what's considered good health insurance and what is the proper role of government in providing that everybody has insurance, and what the proper role is of individuals to take good care of themselves. I can envision, I think a good health plan is one in which individuals are given incentives for good health and healthy habits, and the role of government might be to provide some reinsurance mechanism for everybody who pays, has more than $50,000 or $100,000 in claims. We all get sick unexpectedly, and illnesses, can target us indiscriminately. But I think there has to be a role for individuals going forward, and some safety net.
Okay. What do you think about doctors getting maybe held accountable for the outcome of treating a patient?
Well, I think we should have as much information available to us, but really understand the source and the context of information as we say who the best doctors are and are not. The doctors that practice in certain communities that have favorable demographics might look better than those who practice in urban centers, and vice versa.
Okay. Is there anything that we didn't cover that you'd like to add?
Yeah. No, I'd like to add a way to get rid of a nagging cough, but
Yeah.
I haven't figured that out yet.
Like any last pieces of advice?
No, I think it's important for consumers to shop and make decisions that make sense for them. And if you're self-employed and you're freelance, really, really understand the value of taking every deduction you possibly can, because that is going to lower your taxable income, and that will help you get eligible for significant subsidies to lower your cost of health insurance.
Mm-hmm.
And finally, I'd encourage everybody to get covered, get some type of coverage. It's important. It's important to you. It's important to your family.
Awesome. Is there anything else you'd like to tell us about healthcare.com?
No, it's we're having a lot of fun, and they allow an old guy like me to play a little role. We have some great people from all around the country, and we hope to be doing great things for consumers.
What kind of feedback have you gotten?
It's been very positive. We helped close to 3 million people last year find some type of coverage. We get a lot of good responses from our customers. We got recognized for our growth. We're one of the fastest growing companies in the U.S. according to the Inc. 500. Tomorrow we will be listed on Deloitte as one of the 100 fastest growing technology companies in North America. So we're trying to fill a service, provide a service, and fill a void out there for consumers, and I hope we're succeeding on it. And if we're not, we welcome comments from people. Tell us how to do it better.
Is there anything that that you have in mind that you would like to see from the site or from buying health insurance online in general in the future?
I think over time we'll expand the types of plans and give people even more choices. And I mean, we have most types of plans in the individual market. We may expand into smaller businesses and other types of insurance, and maybe eventually provide some guidance on healthcare and how to get rid of nagging coughs and things like that.
Yeah. Okay. Well, thanks so much. This has been awesome.
Thank you very much. I appreciate it.
Thanks. Enjoy the rest of your day.
Yeah.
Bye.